discussed, there was a question on vaping and nicotine. If you can please address that from your end.
Yes. So I will say that it's a very gray area, and I'll tell you why. First of all, smoking is very clear cut. People can tell you it's been studied very well. Someone can tell you that 2 weeks of cessation of smoking, you start to get some of your cilia back in your lungs. Those are the little cells that kind of expel all that mucus and help you clear coughs. So someone who stops smoking cigarettes, for example, for a few weeks will recover those cells, and then after a month, their airways are more clear than they were, and that's usually the optimum time to operate on somebody if they've stopped smoking for a month. Of course, if you've quit for a year, hey, that's great. A year, almost lungs probably look like the way they did before. But with vaping, this is a new area of study. Now we know it creates things like popcorn lung, and it has effects like that. What we don't know is the timeline. When should you stop vaping? What I would say, if you are somebody who has planned surgery and your surgery is within a month and you haven't stopped vaping already, I would say stopping immediately before surgery is not a great idea. And the reason being is it increases your stress level. You don't want to go into surgery with a higher stress level. The surgery itself is already an inciting agent to increase your stress. So what I would say is if you're able to, if you know out in advance, try to stop vaping 2 weeks to a month before. Recover some of those cells, those cilia back, so that you can clear some things after surgery if you needed to. But for the most part, if you haven't, it's okay. It's not the end of the world. We can still provide safe anesthesia. The risks, obviously, afterwards of respiratory problems like a cough or having increased secretions, things like that, is a higher risk for you. But what I would say is still better than quitting just before surgery. That risk, that higher stress level, is not great for you. 2 weeks before is good. A month is excellent. Anything more than that, of course, is wonderful.
So